Speaker.
Let me check once. अगर मैंने म्यूट किया है तो
नहीं आएगा।
नहीं आएगा।
इसको जस्ट रिमूव उसको बनाइए। ये आप एक काम करो, दूसरे साउंड का उसको लगाओ, उसको बोलो।
एक्सेप्ट करो।
हाँ करो करो। अभी सारे जन करने के बाद
मैं फिर अपना मेल से
अपना मेल से करिए, कॉलेज अपना से इसको साइन।
Sir, can you please forward that link, please?
Please forward the link.
Link to join in the mail.
To your mail ID?
Yeah.
Okay, take it in.
I WhatsApp.
Sir, please.
Just check WhatsApp.
No, then I have to make.
You can enter only those 9 letters. No?
Yes. 8 minutes.
No mail है।
Mail came refreshing. Sir, please submit.
Please.
Yeah.
Admitted.
Admitted, sir. I think net is very slow.
इसको पिन करना है सर.
Can we start now? Sir? Good morning and welcome everyone. Thank you for joining with us for today's webinar. My name is Rakesh Chanda, Faculty College of Nursing, AIIMS, New Delhi, who will be hosting the inaugural session of today's webinar. All of us know that mental health disorders are quite common in this day, and especially during the COVID pandemic era. According to the recent report of Lancet, nearly 15% of global mental, neurological, and substance use disorders occur in India. In 2017, 19.73 crore people, that is approximately around 14.3% of the population, had mental illness. World Mental Health Day is observed on 10th October every year. This day tries to create awareness about mental health issues. This webinar is also organized as a part of Mental Health Day observation. We will have inaugural session first, followed by 4 sessions on mental health promotions. So to begin with, I invite Dr. Deepika Sikaka, Associate Professor, College of Nursing, AIIMS, New Delhi, to give welcome address.
Thank you, Ajish. On behalf of the organizing team and College of Nursing, AIIMS, Delhi, I welcome you all for this webinar. Mental Health Day is celebrated on December 10th and also gives us an opportunity to remember and realize that mental health is a state of well-being and not merely absence of illness. As Ajish was saying, that the world had experienced this COVID-19 pandemic, which took a major toll on the mental health of everyone, and not a single person on the planet was unaffected by this pandemic. And the toll which it took, that millions of people faced multiple losses of different kinds, be it loss of life, be it loss of employment, be it loss of independence. Elderly especially faced isolation and loneliness, and the adolescents and the children who could not go to school faced different aspects of mental health illnesses. We do realize that that we live in an unequal world, and the pandemic has further deepened the divide. Pandemic also gave us a chance to relook into the disparity and inequality, which is like in a hard way to relook and realize that mental health services should be an integral part of the healthcare delivery system, and there is a dire need to scale up these services. We also need to reiterate that mental health is everybody's business. It is not just on the government, the people who are delivering the services, but each and every one of us has a responsibility of, in our own ways, to make a difference in the lives of the people around us. And together we have to take and make a significant difference and create a world where mental health is equally given and there is social justice for all. We, especially as healthcare providers, also need to take care of ourselves, because only if we take care of ourselves, we are in a position to deliver quality care which is expected out of us when the patient comes to any healthcare facility. We have to also remember that even if a patient comes to our healthcare facility with any physical ailment, be it acute illness or chronic illness, there are always mental health needs and concerns the patient has, and we have to also, when we handle the patients, keep that at the back of the mind that he has needs, and that has to be also catered to. Especially related to his illness, there can be many concerns he may have. There can be anxiety, there can be apprehension regarding his prognosis, regarding his disability if it is causing. So as nurses, especially as healthcare providers, we have to be sensitive to the needs, the mental health needs of the people who are coming or taking services in whatever facility we are working. Having said that, the objectives of the workshop is, the overall objective of the workshop is to generate awareness about mental health promotion at various levels. We'll talk about this in the various age groups. Second objective is to mobilize efforts to promote mental health in people with chronic illnesses. And third objective is to sensitize participants regarding the CPR in mental crisis. So thank you so much for joining us. I hope these deliberations will enrich you, empower you, and equip you to become a better mental health professional and a better healthcare provider. Thank you.
Thank you so much, madam. Now, I would like to invite our esteemed guest, Dr. Leta Venkateshan, Professor cum Principal, College of Nursing, AIIMS, New Delhi, to unveil the theme for World Mental Health Day 2021.
A warm good morning to one and all who are attending this session. The chief guest of the day, Dr. Rakesh Chanda, the Professor and Head of Department of Psychiatry, AIIMS, New Delhi, and the organizing secretary of this program, Dr. Deepika Kaka, Associate Professor, College of Nursing, AIIMS, and my colleagues, Dr. Muthu Venkatachalam and Mr. Ajesh, the Associate Professors in Mental Health Nursing Department of College of Nursing, dear students and the audience who have joined us online. World Mental Health Day is celebrated on 10th October all over the world, and this entire week is dedicated as World Mental Health Week. And there are two different themes which are circulating in the social media. So there is a theme which is given by World Health Organization, and there is also a theme given by World Mental Health Federation. Though both are stated differently, I perceive it, the meaning is the same. World Mental Health Day theme given by WHO says, mental health care for all, let us make it a reality. And World Mental Health Federation states it as mental health in an unequal world. I think the answer for the theme of World Mental Health Federation is the theme of World Health, WHO, which has stated. And I also perceive it that we live in a world which is quite unequal. There is gender inequality, there is status inequality, there is inequality between literate and illiterate people and whatnot. So definitely we need to strike a balance that mental health is a concern of every given category of people, and we also should care for them without any difference when they are committed to our care. And unlike physical diseases, the mental health problems are not visible, because when physical diseases are there, there are some symptoms and they want symptomatic relief and they approach the medical fraternity for the relief. But then the mental health and mental illness issues is submerged. It is not visible until unless there is a crisis. But then personally for ourselves and every person we meet, either in the workplace or in the family or when we go outside in the social circle, everybody is in need of concern, love, and everybody may be suffering from some mental health issues. They may be under stress, they may be under pressure, they may be having problems which they may not be able to share with anyone. There may be personal problems which are very peculiar, which they cannot even share with close family, friends and family members. So every person whom we see, I feel we must respect them and we must take it as an opportunity to care for them, comfort them, appreciate them, and talk with encouraging words. That commitment should be there with us, because every human being is in need of some kind of attention and affection. If we follow this, I think many of the mental health issues can be settled. And if you look at in India, we follow the biophysical model of care, where in the curriculum also we give a lot of importance to learn about the biophysical aspects of the illness. But then if we look at Western countries, psychosocial aspects are given more importance. I used to wonder why it is so. India has got very good culture. The family backs up and supports. So the psychosocial aspects of care are not given that much of importance. This was the scenario a few decades, 1 or 2 decades before. But now here also, because of the small family size, we lack family support. We look at patients getting admitted and there is nobody to look after them. Children are calling from other countries and they are asking their friends and other who are not known to them, is it possible to help? The same thing we in our generation also, when we become old, who is going to take care of us? The family size has become very small and children are elsewhere. They may be wanting to help us, they may be able to help us financially, but they may not be able to stay closer to us and extend the physical care and love. This is the problem our society is facing. Divorce rate is increasing. So the children are not receiving the affection. I see in the hostel, earlier when we announce the leave, they will be very happy to go home. But now I receive requests from the students, we do not want to go home, we want to continue to stay in the hostel, we do not have anyone at home. This is the situation. So now the children as well as the elderly population have started depending upon the society for caring for them. Their immediate family members are not available to provide care. This is where the opportunity for nurses arise. When they are committed to our care, we need to understand the psychosocial dimensions of the family, and we can replace the affection and care which a family member will provide. So this is a great opportunity for every nurse who is caring for the patient to extend the psychosocial support. So it is very essential to celebrate such mental health weeks and mental health day. So we concentrate and we understand the importance of any given day which is observed. So I must congratulate the organizing team for taking the efforts to observe World Mental Health Day, as well as they have week-long activities. They have activities for patients, they have activities for the students, and they have also activity to bring out the creativity in the students to contribute towards mental health. And we must acknowledge the support of the Department of Mental Health in AIIMS, headed by Dr. Chanda. Any activity organized by College of Nursing, they are always willing to extend their support and contribute. So that way we are fortunate to collaborate with them and to organize this function. And all the topics are selected towards mental health promotion. To bring equality in the theme and topics covered also, we have Dr. Catherine Purna Selvan, who will be talking about a new topic, that is there a CPR for mental health? We always talk CPR for physical illness, cardiac CPR, and we have ATLS, PALS, NALS and whatnot. But in mental health also there is a CPR. We will be listening from her. And I am also thankful for the stalwarts in mental health nursing like Dr. Bimla Kapoor, Dr. Arun Jyoti Barua, and Dr. Renju Susan Baby from Bhubaneswar. All of them have consented willingly when we contacted them to address the audience. So on behalf of the organizing team, I thank all of them, and once again I congratulate the organizing team for taking all the efforts to successfully observe World Mental Health Week. Thank you so much.
Thank you so much, madam, for unveiling the theme, emphasizing the importance of mental health and the role of a nurse, and thank you so much for motivating us. Moving on, it's my pleasure and honor to introduce our esteemed guest, Dr. Rakesh Chanda, Professor, Head of the Department of Psychiatry, AIIMS, New Delhi, and Chief, National Drug Dependence Treatment Center. Sir has more than 37 years of experience in psychiatry in various leading institutions of India and abroad, and Sir is a recipient of various awards for his service and got numerous published work. I welcome you to Sir for keynote address.
Thank you.
Yeah, this is
Dr. Lata Venkatesan, Principal, College of Nursing, Dr. Deepika Khaka, Associate Professor, College of Nursing and organizer of today's event. Professor Guleria, our director, who is Director AIIMS, will be joining virtually. Colleagues on the dais and dear students. A warm good morning to all of you. It gives me a great pleasure to be here on the occasion of World Mental Health Day 2021 celebrations. As already pointed out by Dr. Lata Venkateshan, this year we have two overlapping themes, mental health for all, let's make it reality, and mental health in an unequal world. Basically, the theme from the WHO is a explanation, or say a kind of a work plan for implementing the theme of the World Federation for Mental Health. Mental health has been an integral component of health, though the World Health Organization recognized it while giving the definition of health way back in 1948. But mental health is something which has often been ignored. It was in 1990 when the first report of global burden of disease, which was supported by the World Bank and WHO, came out, and it was published in 1993, that the mental and substance use disorders were recognized as one of the leading causes for the global burden of disease. That emphasis was put on the mental disorders as from the public health point of view, because before that it was basically the mortality figures which used to be the basis for determining any contributions for the health budget to different illnesses. Over the period, we have realized that the mental disorders are a leading cause for disability, and amongst that, depression is one of the leading causes for that. In the last 15-20 years, with the virtual media coming, spreading its wings, and with the Wi-Fi and internet getting cheaper, it has led to a new mental health issue, because the face-to-face communication, in-person communication has come down, and with the COVID in the last 20 months or so, which led to lockdown and closure of most of the establishments, including the academic institutions, and more and more virtual classes. Like in today's program also, virtual classes have some advantage because people from distance can join virtual sessions, I would say. Like in today's session also, we have a number of dignitaries and students who are joining from distance. But it has limitation that in-person, face-to-face communication becomes restricted. So that also has a lot of problems, associated problems. So, and that leads to more of social isolation. So basically, that's a COVID was associated with a lot of mortality, morbidity, and financial implications. All these stresses and the closure of institution, all these stresses, and the fear of the infection, and all these led to a kind of tsunami of mental health, that it has been labeled by some of the policy makers that it is a tsunami of the mental health problems. So how to fight it? How to fight it? I would say there are some basic principles of maintaining mental health, which are being ignored, especially by the younger population, in the recent, especially with the increase in the use of the virtual media, because we are a new disorder, that is the internet gaming disorder or behavioral addictions, has come into being, and it's being recognized, and it has entered the classification systems also. And it's having a lot of adverse impact on the mental health as well as on the physical health, because people are clung to the social media, and that's more social media should be used constructively, should be used for specific purposes. You can use it for social communication, but it should not be at the cost of your primary responsibilities. This primary responsibility could be responsibility towards the family, responsibility towards the career, responsibility towards the society. There are so many things. So it should not be and the responsibility towards maintaining your own physical and mental health. So if you are using social media till late in the midnight, or you're sleeping at 2 or 3 a.m. just because you're chatting with someone, or say, hey, or you are looking into some playing some games on that, so that's not the right thing, and because that is affecting your physical and mental health, and also so that has a lot of adverse consequences. So that's one area where we need to be careful. And as health professionals and nursing professionals are the, I think always the first contact which any patient makes for seeking any health services. And so that way, this message this message has to go first from the nursing professionals that maintaining physical health and maintaining mental health and maintaining a daily routine of waking up and sleep. One should sleep for 7 to 8 hours. A physical exercise, face-to-face communication, uh, and staying away from the drugs and alcohol. These are the basic principles for mental health as well as physical health, and this message can go from the all health professionals and including the nursing professionals who are often the first point of contact. In today's program, I'm very happy that we are discussing mental health promotion. We are not discussing mental illnesses or depression, anxiety disorders, and mental health promotion in the vulnerable population, vulnerable women, elderly population. As Dr. Lata pointed out, the families are becoming smaller and smaller. In fact, there's a term which has been used, empty nest syndrome, with the children moving away and the parents, elderly parents being left. So that is called, this term has not come from India, it has come from the West, empty nest syndrome, which has led to a lot of other issues. So, and then the mental health problems in the patients with chronic illness, chronic physical illnesses. So there also, especially the malignancies or other chronic debilitating illnesses like in neurological illnesses. So that's another. So these are the areas where we need to identify the mental health issues and try to resolve that. So that way, today's program is, I think, it's very well designed. And with these, I would like to congratulate again the College of Nursing for organizing this event, and thank you all. And I hope all of you will have new learnings from today's program. Thank you.
Thank you so much, sir, for the words of wisdom, highlighting the magnitude of mental illness, disease burden, and what are the common mental health issues during the COVID pandemic and how to deal effectively with these problems. Thank you so much, sir. Next, I would like to welcome our chief guest, Dr. Randeep Guleria, Director AIIMS New Delhi, to address the audience on the occasion of Mental Health Day observation. Because of busy schedule, sir could not join physically. Sir has sent a pre-recorded audio. I am playing that now.
At the onset, I'd like to start the congratulating the College of Nursing of the All India Institute of Medical Science in New Delhi for holding these multiple activities along with the webinar that they're having today as part of the Mental Health Day 2021. The theme of the
Just check that. Minimize this.
Start from the beginning.
I shared it all the chat. Yeah.
Okay, now only it is getting checked.
It will take some time.
Yeah, now you play.
Okay.
From the beginning.
So here we are starting it again. Sorry for the technical glitches.
At the onset, I'd like to start by congratulating the College of Nursing of the All India Institute of Medical Science in New Delhi for holding these multiple activities along with the webinar that they're having today as part of the Mental Health Day 2021. The theme of the Mental Health Day is to let's make it a reality, and the focus the WHO has put forward is that mental health is in an unequal world. What it means is that there is still a lot of inequity as far as mental health is concerned. If you talk of mental health, it is something which is becoming more and more important. The COVID-19 has really shown the huge burden of mental health that there is, and the fact that merely the absence of disease does not mean that you are well. And that is very, very important. Very often, doctors, healthcare workers, administrators are so busy managing things which happen in terms of crisis or trying to really look after people who are having disease and do not focus on the so-called well people who may have multitude of mental health problems. And therefore there is a need to increase awareness as far as mental health is concerned. And this became more and more apparent during COVID-19 because it caused problems both in terms of the increasing number of issues that aggravated mental health, in terms of the lockdown, in terms of loneliness, in terms of fear, and the stigma that was associated with COVID-19. Along with that, it also threw fresh challenges to mental health professionals in terms of how do they reach out to those people who have mental health issues in an era of a pandemic, in an era of the lockdown, in the era of restrictions. And I think that became the biggest issue in terms of managing patients who had mental health issues. But I'm very happy that a large number of people came forward and were able to resolve these issues. The College of Nursing also has been working aggressively during the pandemic to address these issues, not only among the healthcare workers, the nurses, the students, both undergraduates and postgraduates, but also the general population, to see how they can increase awareness and reach out so that no one is left behind. And that is the basic theme that we should have as far as mental health is concerned this year. So there should be no inequity in terms of the world, in terms of managing mental health issues. Often people who are marginalized get left behind, and they are the ones who have the maximum number of mental health issues and suffer the most because treatment is not available to them. Therefore, I think the number of activities that the College of Nursing is doing during this week will really help in increasing awareness among all strata of society so that we can really come forward and address this issue of mental health, not only in the coming few days, but make it an ongoing activity so that throughout the year we are able to address issues of mental health both in our colleagues, in the college, in the institute, and among the patients who come to the institute. I wish the college the very best, and I'm sure that they will really do a lot of good activities in the coming few days. Thank you very much.
Thank you so much, sir, for encouraging and motivating words, especially giving the importance of mental health in the era of pandemic. Moving to the final part of the inaugural session, now I would like to request Dr. Muthu Venkatachalam, Associate Professor, College of Nursing, AIIMS, New Delhi, to express the vote of thanks.
Good morning to the one and all present here and connected online. Honorable Chief Guest Professor Randip Guleria, respected guest of honor Dr. Rakesh Chanda and Dr. Lata Venkateshan, faculties of College of Nursing, and all the participants. It is such an honor for me to get the opportunity to thank you all dignitaries. On behalf of College of Nursing, I extend a warm welcome to the people who joined this webinar. I extend my gratitude to our Honorable Chief Guest Professor Randip Guleria, Sir, Director AIIMS New Delhi, to take out time from his busy schedule to grace the event with his inaugural address virtually. Thank you, sir, for inspiring and encouraging us with your words on this special day. A special thanks to Dr. Rakesh Chanda, Professor and Head, Department of Psychiatry and NDDTC, for his gracious presence on this inauguration program to deliver the keynote address and providing immense support to make this webinar successful. Thank you, sir. I would like to take this opportunity to place on record our hearty thanks to Dr. Lata Venkateshan, Professor cum Principal, College of Nursing, for the constant support and guidance she has extended to all of us. I need to mention my sense of appreciation for the initiatives taken by her to encourage numerous programs like this by College of Nursing in recent times. I also wish to express my gratitude to Dr. Deepika Kaka, Associate Professor, College of Nursing, for her initiative and support in making this program a reality. I must thank my colleague faculty members in the organizing team, Ms. Yumnam Subbala Devi, and Mr. Ajesh Kumar for their immense support and cooperation in organizing this program. Further, we are grateful to the expert speakers, Dr. Bimla Kapoor, former Director, School of Health Sciences, IGNOU, Dr. Catherine Purnaselvan, Lead Mental Health Instructor, Middlesex College, Edison, New Jersey, USA, Dr. Arunjyoti Barwa, Professor and Head, LGB Regional Institute of Mental Health, Tejpur, Assam, and Dr. Renju Susan Baby, Associate Professor, College of Nursing, AIIMS, Bhubaneswar, for consenting to speak in this webinar. I also would like to acknowledge our gratitude to our MSc Nursing students for their support and cooperation in arrangement of this webinar. I may express my sincere thanks to the said facility staff for providing technical support, without which this seminar or webinar would not have been possible. Last but not the least, I would like to express my gratitude to all the esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. Thank you.
Thank you, Dr. Thank you, Dr. Muthu Venkatachalam Srinivasan. Here is the end of inaugural session. Thank you so much, all the dignitaries on and off the dais for gracing the occasion. Here we are taking a break. We will be resuming in few minutes with the sessions on mental health promotion. Thank you once again. Okay. Sir, are you ready? Can I ready? So here we are going to start our sessions. So now I hand over the mic to Dr. Muthu Venkatachalam sir. Over to you, sir.
Just pin this screen. Please pin the screen. So good morning all the delegates. So we are going to start the session. For the first session, I would like to introduce the speaker, Dr. Arunjyoti Barwa. She is Professor and Head of the Department, LGB Regional Institute of Mental Health, Tejpur, Assam. She has completed BSc Nursing from Guwahati University in 1991, MSc in Psychology from Guwahati University in 1994, MSc in Psychiatric Nursing from NIMHANS in 1997. She has completed MPhil in Nursing from Manipal Academy of Higher Education in 2003, and she completed PhD in Psychiatric Nursing from National Consortium for PhD in Nursing in 2014. Some of the awards and honors: more than 30 publications in various national and international journals, resource person for various national and regional conferences, seminars, and CNE. And she is also a PhD guide for National PhD Consortium conducted by Indian Nursing Council and Guwahati, and also for Guwahati University. She has membership in TNAI, ISPN, NRSI, NIMHANS Alumni Association, Manipal Academy of Higher Education Alumni Association, World Association of Psychosocial Rehabilitation, Psychologists Association of Northeast, and Indian Psychiatric Society. So I invite Dr. Arunjyoti Barwa to present her session. We are eagerly waiting for her expertise on this. Thank you. Ma'am?
Thank you.
Yeah. Please, you can share the screen.
And one, please. Excuse.
Please share your screen, ma'am. Yeah, you are audible. Please share your screen.
Just a minute.
Yes, it is being shared.
Is it visible? Screen?
Yeah, your screen is now shared.
Not sit there.
Go to presentation mode, ma'am. Yeah, right. All right.
Good morning, and one wishes on the occasion of World Mental Health Day 2021. Esteemed dignitaries of the dais, Director, AIIMS, New Delhi, Sir SOD, Department of Psychiatry, AIIMS, New Delhi, Principal, College of Nursing, Madam Dr. The other are renowned mental health professionals, personnel who will be in the platform today. But the faculty from Department of Psychiatric Nursing in Delhi, Dr. Muthu, and all the esteemed participants in this digital platform today. I am very much delighted to be with you all in this platform today on this occasion, and would like to take this opportunity to thank the organizer for giving me this opportunity. Thank you, Hussein. Today we'll be talking something on in this unequal world of mental health. Let's make mental health for all. To make it relevant, let us take some vulnerable group of people, how we can make the mental health for them all and make the mental health nursing services reaching all in real practice. So today my assigned topic will be on mental health promotion of vulnerable women. Before going to start the discussion, let me give just one second. While starting the presentation, let me give you the outline of the presentation so that I feel this outline will help us to go along the presentation during the discussion and in questions. So we will probably be going to do during this next half an hour. We are trying to see what is women's mental health, who are the women considered as vulnerable, why the issue of vulnerability is important in mental health as well as mental health nursing practice, mental health issues in vulnerable women population that we are going to see, and the promoting mental health in vulnerable women, what are the nurses concerned, and few of the practice initiatives that is being started rather implemented. So with this outline, let me start with this discussion. WHO views mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with normal stress of life, can productively and fruitfully and can make contribution to the society. So while we are talking about mental health, while we are talking about promotion of mental health and protection of mental health, we are trying to focus on these particular concepts. Women's mental health is primarily psychological well-being of women at different stages of life, and that is from childhood to old age. Also, while we talk regarding women's mental health, we do include the concern on access to care, quality of life of the women, and the prevention of various mental health issues in general in women. Now, let me take this slide on, saying, is there any differences? Why women have look differently? Why women mental health needs to look differently? Like many times in the program while studying psychiatry, while accessing mental health services, we see that there is separate sections on women mental health, or there is separate emphasis on women mental health. So why? Is it really needed? In general, the women are being considered as vulnerable for some mental health issues, some kind of mental health issues. And also, there are various input approaches that are in place to handle these issues to promote mental health of women. But only thing the question, there are really, we have some approaches, we have some intervention in text to handle these various kind of issues. But the implementation of this intervention and approaches are question. So this kind of discussions are needed to take again and again. As I was talking on, is there any differences? Yes, there are some differences which makes women more vulnerable in general, like in psychobiological makeup. Then in terms of lifetime prevalence of violence, these are some evidence-based, there are some evidences that lifetime prevalence rate of violence is really higher in women. Then yes, women do differ in the style of communication, dealing in relationships, expression of their feeling, and handling stresses, etc. So these are some things that we need to take in consideration by planning some intervention for women. Also, I feel this is an important factor in making a difference or putting women in a different level of position is social molding too. All of us being women, we experience the social molding, how it has made us think somewhat differently. Being conscious now, we are trying to look at those things back and trying to somewhere modifying, somewhere incorporating some new things and trying to do many things. So this social movement has a greater role in making the personality, making the person different in views, in kind of expressing, in kind of communication and things like that. So these all are the things where I'm putting in these slides because these have some relevance in giving the intervention to women. Until and unless we understand all this, we cannot effectively design an intervention. We do see some differences in terms of some issues. Like for example, I am putting here depression, anxiety, psychological distress, which are found to be 2 to 3 times more common. There was we stated that women are having more internalizing problems, where men have more externalizing problems. All of us do understand what the internalizing and externalizing problem. For example, externalizing the aggression, abusive, kind of behavior that is being seen, and internalizing is not taking the stress to person is showing some symptoms of sadness, feeling sad, frustrated, getting depressed, kind of things are being seen more among women. Here, vulnerable women by this vulnerability of women we need to understand and what we can do. Let us going to see. Let us going to see in these few slides. There is serious issues that may be presented in vulnerable women with continuing essential mental health care delivery. So this continuing essential mental health care delivery is an important focus for this discussion. And also, I already mentioned that there are various factors associated with psychological vulnerabilities of women. So those factors also we need to take consideration in designing. And let me give you some the group of vulnerable women to make our care more focused. Because as we understand there are different groups of women. As I told in general, women are vulnerable. Out vulnerability also there are some who are more vulnerable at the time. The situation, the environment, the condition that makes them more vulnerable towards mental health issues or mental health problems. So we have to focus on the care towards those particular groups of women. So for this purpose, we are categorizing this different groups of vulnerable women. So let's go for that. Talking about vulnerable women population, we do frequently other regarding antenatal, perinatal, and postnatal women. Are they really vulnerable? Is there any reason to be vulnerable? Yes, if you go through some literature, if you see some research evidence, or if you see in and around, you'll be seeing that there are reports or there are evidences that 1 in 3 to 5 women in country like India might have some significant mental health problems during or after childbirth, during the process, after or during the pregnancy. So usually what do we see? Usually more the problems that is being seen are depression, anxiety, or many times we do notice that relapse of pre-existing mental health issues which were maintained maybe or were in normal conditions. During this period, it might get relapsed. So while making plan for working with this group of women, we might need to think of some reasons that might be associated with these mental health issues in this group of people, because we were not seeing in all kinds of women, all antenatal, perinatal, postnatal mother mental health issues, but some we were seeing. So why? What is the reasons behind? So it might be lack of some support that one, and it may be social support, or as I told, there might be some pre-existing mental health issues, or there might be some adverse life event, or high perceived stress may be another reason. So what I think to say here, these are some conditions that makes this woman more vulnerable. Like for example, now what the situation that we are going through this current pandemic. So pandemic itself is a stress for I feel from common people itself it is a stress, because fear, uncertainty, anxiety about the disease, getting contacted, what will happen, how do I get treatment, whether I'll be able to protect myself or my safety, kind of worries, anxieties that are making the woman more vulnerable. So these are some things that we have to take in note. Then some other groups of vulnerable women, we consider women with substance addicted families or spouse. In studies, we are seeing that lots of alcoholics, there are lots of studies, lots of research that has been done on molecular alcoholics, families of substance use, person with substance use disorder. So it is been seen that there are psychological stress, depressive syndrome, or kind of violence or partner violence. Those things are more common in this kind of family, which in return makes the women in the family as vulnerable women. Then also we have another group, important group, that is menopausal women. So menopausal, during this period, as we know, there are in general there is a mood sense, like kind of irritability, sadness, low motivation, poor concentration, increased. It is being also reported that increased percentage of sleep difficulties, kind of problems. So this condition itself many times makes the woman vulnerable to get some kind of mental health issue if the other stressors precipitate the condition. Then also I would like to take the women in account who are in stressed family. When we are talking about the stressed family, we do say who lives in the families where there is a person or other family members with mental health issues. As I already mentioned, there is a person with substance use disorder, substance misuse. The families where there is a conflict in relationship, or there is a social isolation, or maybe financial issues, or or children with environmental difficulty, differently able person in the family, or differently able child in the family. So all of these kind of families might make the family a stressed family, and this stressed family may trigger various mental health issues in women if it is not taken care of. Bringing to the other vulnerable groups, while we are talking on vulnerable women, maybe one group who are victims of domestic violence. It is very much common issues in the society at the present, and it's getting lots of attention too from the policymaker, from the mental health care provider, or the other care provider. It is getting attention, and there is also really a need to take care of this group of women, as there are some WHO report also which states the who are victim of domestic violence shows the increased problems in having stress, positive stress. It may be subjective stress or depression, living in fear, anxiety, having low self-esteem, which itself is an triggering factor for various mental health issues, sexual dysfunctions, then problem eating disorder, eating problems, obsessive compulsive disorders are found to be high in this group of women. Then social isolation, then difficulty coping, compromised coping, then poor problem skills. So these are some issues already being evidenced in this kind of women who are victim of domestic violence. So it needs to be taken care by mental health professionals definitely. Then there is another group of women who are destitute, who are homeless. So destitute, homeless women, as you can understand the stress or the psychological trauma that they are going through, which might make them vulnerable category of women. We may have another group of women coming from disadvantaged social groups. So disadvantaged social group here we mean that they are less privileged to have better facilities in the society, like it might be immigrant and migrant women that we are seeing. We are getting in our mental health care facilities. Do they many times they have to come and get access to the care? They do have some kind of demonstrate some kind of mental health issues, or the women who are not sufficient in regards to finance or education. women with less privilege to have the education in their life. It might be health literacy, it might be general literacy, or women who are stigmatized and discriminated. More importantly, physical, sexual, and psychological abuse. The women who are in this disadvantaged group of women, we do usually take the issues like abuse more, reportedly more abuse in this group of women. Then women with disabilities. When we talk about disabilities, we do cover the disabilities, may be simple working disability to hearing to with disability, all kind of disabilities which makes their life restricted life activity, and it might the stress that is being caused might make them put into the vulnerable category. And this victim of abuse, victim of abuse may be that childhood abuse, maybe psychological abuse, maybe physical abuse, maybe rape. So kind of abuse that might make these women vulnerable to mental health issues. Living with various chronic health issues like, for example, women living with HIV and things like that, where their mental health needs to be taken care of very much because the trauma, the stress that they are going through itself is making them more vulnerable for different kind of mental health issues. Women with psychosocial stressors are also being vulnerable. They're also under vulnerable population group. I'm not going to deal because my respected Madam Dr. Vinda is going to handle this elderly women population in next few minutes. So, understanding the vulnerability, this vulnerable, the importance of this understanding of vulnerability, understanding different vulnerable women group. Let us now see on designing and delivering essential mental health care interventions to promote mental health. So this next few slides we are going to see how do we can take initiatives as a mental health nurse or mental health professionals to promote mental health. The need of different group of vulnerable women population, various mental health interventions are initiated. That includes the preventive as well as promotive measures of mental health nursing interventions. So while designing this mental health promotion, while implementing this mental health promotional activities, we do keep some targets in our mind to achieve those targeted through our these mental health promotional activities. For example, we are putting here these few targets that towards this mental health promotion. One, I would like to focus on emotional behavior. Since mental health care is very important to maintain the emotional equilibrium, so our target is to achieve that emotional equilibrium. Then also, all of us may that equilibrium well-being when a person has, it is very much easy to manage the stresses of life. So challenges and pressures that can be easily managed. If we have this well-being, so our target of promotion will be adequate well-being among this group of communities. Then also we do believe that strengthening one's ability to adapt will definitely help them to handle the stresses positively. So our target is to strengthen the adapting ability. So seeing all these things, what we do, including essential care delivery, will be including looking to enhance the adjustment, learning to handle the social isolation, the resilience of the person, etc. So these will be our targets to promote mental health, and these will be our goal in designing our mental health nursing. All of us know the focus of the focus of care is needs to be simply enhancement of well-being towards others. So I do believe this current situation, our focus of care, we should seek to enhance the well-being, because we don't have to see problems are happening. The problems don't want them to come to us. Why can't we make an attempt or some initiatives to that we can prevent these issues before it happens. So towards this, what we can do, being a nurse, being a mental health nurse, we can make some initiatives in recognition and identification of various mental health issues. We can look for identification of early warning signs in these vulnerable groups of where do we have discuss groups. We can look for warning signs in their mental health issues. We can try to have awareness activity, create awareness among themselves, among the society, so that each one of us can help each other to identify issues to promote the well-being. Then we have some kind of empowering, psychological empowering of vulnerable women, psychological empowering means empowering, giving the power to the women to handle their stress at their own. Can have some facilities for referral. That means person, people in the society, they should know what to be done if some kind of there's some kind of issues, what to be done, where to go, whom to consult, how the person to be helped. These kind of information are very much required in the society. Lies the link that I would say, because I feel it is the most important activity right now. Listening with different kind of settings. It might be a total domestic violence. So women are more vulnerable. So where do we, as a regulate where do we have report kind of places that tell can or in terms of lettering services can be done where we consider that there might be a group for making these tools. So licensing may be done there. So licensing may be done in general healthcare settings, because I told already that women in prenatal, postnatal, they are more vulnerable. So country licensing those kind of settings, country offers some mental health services. If cannot, initiatives we do speak, even though we speak, even though we think, even though we feel, we are not able to because of our some limitations like personal and things like that. So can't we have the general nurses who are working here in those kind of settings? Can't we equip them to handle this kind of issues, at least helping them, identifying them, reporting them, or looking to maybe we can definitely do this kind of things in this kind of for this kind of women. That's what I told earlier, that where do they refer, where do they come, how do they get help, they can go, and right now more relevant things are available services. So making them people aware, making this vulnerable group of women or any development aware about the helpline services where if any kind of needs they feel where they can approach these helpline services, like crisis intervention, like mental health helpline. In all the institutes nowadays, at the helpline numbers, almost all institutes they are displaying this helpline service number. So this kind of help is, I think, a great initiative. Then resilience building, there are various programs that can be taken in women for in menopausal group of women in the school college going women, or women in so kind of every stage life, the resilience building, it is very important aspect of life, which makes a person strong and makes the person able to adapt with any kind of stresses of their life, thereby preventing different mental issues. Then, facilitated communication, this is most important aspect of us, particularly women. Let them speak out the issues, give a platform, give a place, give a way to speak out themselves, so that they comes out with their problems, not internalizing their problems and getting stressed and distressed by self, with all the troubles, all the environmental factor of the stressors, not let them get stressed to themselves. They need not mental health services. The mental health services, what do we have? I think that some mental health services we do have in the community, we do have in the hospital, we do have in the various places in various extensive services. So let's have some operating of the services. Let's utilize those services for well-being of women. So by designing this mental health promotional activity, we have to keep in consideration of some challenges. This actually came to my mind after pandemic. As we are also finding lots of difficulties in working in community, working with the people, when these problems we are facing, we do have to account these challenges. Like for example, mode of care delivery. So what mode of delivery we do take, because we don't want these mental services, mental care activities to get disrupted. We want, as I told, this is the basic principle that continuity of the services to be maintained, essential mental health services continuity to be maintained. So apart the mode of care delivery so that we are taking into account, then different patterns of problems and women is vulnerable. What are the kinds of problems that we might expect? So that has to come into account in the care delivery. The magnitude of the problem, what amount, what is the most, getting most frequent problems, or most number of problems that is coming into, then handling excessive services. It is also very much important. Many they have some issues, they cannot access the services because of handling excessive services. So how we can remove this kind of services. And if I will not close the time, please just let me remind.
Yeah, ma'am, we are running behind time.
Thank you. When we are talking regarding health promotion, I feel it is very important to ensure mental health is a part of health promotion, because as we have seen, health promotion activities are in general, it is really getting into place. Now we are linked for various personalities or AIIMS, they are putting various kind of health professional activities in place, but where is somewhere that mental health promotion is lagging little behind. So we can ensure this mental hygiene practice as a part of health promotion. We inculcate positive emotional attitude, thinking, or constructive emotional expression that is to how do the emotional expression is also important, practicing constructively, practice of problem solving skills, this problem solving is important, this is an important role of a life in a person. Then good interpersonal relationship. So these are some kind of mental hygiene practice that we can include in our general health promotional activities, even if we not take much time on it, it's a concern. Also, it's one important aspect of women's life, sense of self-worth. So, sense of self-worth, do the women get this sense of self-worth, or how women do develop this sense being women, all of us, we can possibly, we can understand it, we can ourselves and internalize your like own emotions, you can understand how it gets here. It gets create some positive feedback that we have received from our parents, our family members, teachers, or society in general. So these are some key, key places or key persons who can help in boost the self-esteem of the woman. So what we can do, we can include in our awareness spreading activity. Because spreading little bit exercise, like encouraging and activity kind of things, even though
Excuse me.
they don't want to show
Ma'am, sorry to interrupt. We are running behind time, madam. Can you please try to wind up?
Yeah, I'll take 2 minutes there. So other activities that I was including, actually I took time into the first part. So I think lack of illness in a little group of women have a common barrier. Then there's some practice initiative that we have also taken by being in place. Like for example, understanding yourself, taking care of self, emotional self, or working women for house, housewife, respective women are in place. Then I feel, as I already been mentioned, the capacity building in nursing and preparing nurses to work in the grassroots level is an important component of mental health promotion. Procedure resources which can be managed for integrating this mental health into the environment. So there are some efforts of this institute that is being taken up through digital academy, digital training of special nurses. LGB is a part of LGB initiative to incorporate mental health in general health for primary care nurses. Information on the opportunities to learn to be provided to the women with vulnerable group of women. Then connecting various existing services. These are some practice initiative that is being done here. So that I just put as an example here. Like these kind of activities, all of us, if we take these are the small, simple steps. If all of us we take these steps, we can really make it different. We can really bring the difference in mental health care. So regular visits for various vulnerable community groups or assessment of family environment, things like that. This actually, I was putting this slide to give you the example of an intervention on promotion of mental health that is being originally instituted by one of our PhD scholars, pro-antenatal and postnatal mother, how we can by developing different kind of interventions, as we see in India, really it is the latest intervention on promoting mental health of this vulnerable. So this is being doing vulnerable women fight for us in getting the problem and taking the problem and getting early interest. Working with kids, already I have given a glimpse and promoting mental health in women with mental health member. But before concluding, I just like to put some issues to keep because these kind of issues only can or make us great being a professional design some kind of interventions or activities. There is a disparities in distribution of community-based mental health services, resources less. So what we can do, given some examples what we can do with the resources, awareness of mental health care professionals, then initiate in mental health nursing service implementation. So that is should come from us. We should be able to get. So let us bring the difference in mental health. Let us help everyone to live with mental well-being. So these are some kind of activities. These are some kind of activities for the nursing group of students who have just joined the clinics. These are some activities, these are some activities that we can carry out in the community in antenatal setup, day of subcenter or the basis. These postnatal activities, then our own healthcare professional nurses they are being vulnerable in this kind of situation that we are undergoing, so we can take care of that. Collaboration between mental health programs to reach the elderly. Then
Excuse me. I'm sorry to interrupt, and next speaker is waiting, and we are running out of time. Conclude. Yeah, thank you.
So, in conclusion, let me tell you, let us take the pride of taking mental health care for all in relationships. That was me. Thank you. Thank you for the opportunity. And sorry that I apologize for going too much beyond the time.
Thank you very much, ma'am, for covering this important topic. I know that we have given you very less time to talk this broad topic. Thank you very much for sharing your experiences in this area. Next, I would like to invite Dr. Deepika Kakka, Associate Professor, College of Nursing, to introduce our next speaker, Dr. Bimla Kapoor. Ma'am, you can come here. I have a slide.
Good morning to all of you. It is my proud privilege and honor to introduce the veteran in the field of nursing, Dr. Bimla Kapoor, though requires no introduction. She has made phenomenal contributions in the field of nursing. This is not going to do justice for what introduction I'm going to give about her. I have been so honored that Madam was my teacher in undergraduate program, and because of her, I took up psychiatry. She was so exemplary as a teacher, and I still remember her. I still remember her classes, and it has made me whatever I am today. Madam has a significant contribution in that. To introduce the Professor Bimla Kapoor, Madam Madam has various affiliations. She is a chairperson of Experts National Nursing Commission Bill 2020. She has been a former director and professor of School of Health Sciences, IGNOU. She was formerly the head of the department of the Continuing Education Cell and Psychiatric Nursing Department at RAK College of Nursing, Delhi University. Madam has many laurels to her cap. She has been honored by President's Gold Medal for MSc Nursing. She has won T.K. Agarwala Prize for Research. She has been also awarded Nehru Foundation for her excellence in nursing. She has been awarded WHO Fellowship, a country representative to Bangkok on rational use of drugs and CRO. She has been awarded NHS 50th Anniversary Fellowship by British Council at UK. She has been a member for Sigma Theta Tau International Honor Society of Nursing. She has been elected as first president of the Delhi Nursing Council. She has been very phenomenal in making Delhi Nursing Council. She was one of the pioneer members in that. She's been chosen for distinguished standing and conferred with honorary appointment to the Research Board of Advisors in USA. She's been awarded International Friendship Society and Vijay Shri Award and Certificate of Excellence for outstanding services and achievements and contributions. She has many laurels to her credit, and she has been a kind of a icon in nursing. And we are very honored that she consented to speak on this topic of the mental health promotion among the elderly. Over to ma'am.
Thank you so much, Dr. Deepika and team. I'm sorry that you had to stop Aranjyoti, and she was really speaking very well, but I know that you have to take care of your time management also. Well, we first addressed Dr. Chanda, who has been really gracious enough to see that together you plan the activities, and I think this is an example for the whole country and also for any institute that no activity or no work should be done alone as professionals. It is always good to do as a team. And I congratulate College of Nursing under the leadership of Dr. Lata Venkatasan and also the organizing committee, Dr. Khaka and her team. Thank you, Dr. Chanda, Dr. Lata, I mean, it's people across the globe, Dr. Khaka and her organizing team, faculty, very, very good students, especially the master nursing students who are really learning under the leadership of the faculty of all these medical sciences, invited guests. It is definitely a pleasure to me to be a part of this celebration of mental health nursing and mental health day, because it is highlighting mental health care for all. Let us make it a reality. Of course, you have the other of unequal distribution, no problem about that, but I think it covers, the both are complementary to each other. WHO talks about the working pattern of it, and World Federation of Mental Health talks about scenario waves all over the world, so that people are aware of it. Well, professionals think, or everybody thinks, that elderly people, the elderly people we talk about, immediately idea comes, oh, retired, oh, they are dependent on others now, too idle, to criticize people, to scrutinize people, always grumpy and all that. No, I don't take it, because I feel age is just the numbers. We have to start thinking from that angle, that age is just the numbers. It is up to us. How do we remain active, alert, and contribute to the society? Especially if the health professionals, nursing professionals keep taking the health provision or keep taking care of the health provision steps for the older adults. I'm not calling elderly because now the gaps are changing in elderly. We are having sometimes we call that. Are you able to see me?
Yes, ma'am. We
Hello?
can see you and hear you, ma'am.
Okay, thank you. Sorry for interruption. The WHO is defining now the older adults into different manners. So whether you take 65 to 75 as young adults, and then you take as older adults, and then you take as very after 90 plus. So I feel very comfortable of this division, because you cannot be so old at the age of 60. You cannot be so old at the age of 65 or 70. You can be old at the age of 80 plus 80, and I mean, this is what the mentality of the people is now. They're very active, they're very alert, they're contributing to the society in different manners in the age which after that they are able to do. Well, the United General Assembly has declared 2021 to 2030 the decade of healthy eating. So you can also see how the things are progressing. They also felt that it should be adopted as the wide approach in support of healthy aging. Because if there is an international action taken to improve the lives of older people or older adults, their families and communities, both during COVID, before COVID, God forbids any other infection of such kind is there, they are able to contribute to the mental health of older adults. I'm going to use the word older adults and not elderly. Pardon me for that. We are also facts that globally the population is aging rapidly between 2050 and 2050. The proportion of the world's population over 60 years will nearly double from 12% to 22%. That's huge in the world. But the scenario is almost similar in our country. The number of older people is growing in India too. As of 2019, over 139 million people living in India are above the age of 60 years, and this is over 10% of the country's total population. The proportion of older people is expected to almost double in 2050. That will be 19.5% or nearly 20%. Now this is happening because the health scenario which the older adults are looking after themselves is improving. They are getting educated. They are the population who are able to understand that it is not that if I have crossed 60, I have to just sit outside and keep grumbling and watching for the day to die. No, whether it is at a village level also, I have seen a lot of improvements are coming in thinking of the pattern of the older adults and how they can work, how they can contribute. At least they can teach their grandchildren or they can go out and teach some women. So there are a lot of things of this kind coming in the mind of people. Maybe in the remotest of remote area where the awareness or information is lacking, there also people don't want to be useless now. They want to be till the end of the day. Now you imagine that if we are going to have in 2050 the elderly or older adult population so high, it means that every one in 5 Indians will be older adults. Just 60 years and above. Don't think 80, 60 years and above. And I think by then the definition of the older adults will change and maybe 60 years will be young people still. Out of them, 67 million are male, whereas 71 million people are female. This is according to UNESCO study, an elderly study on 2021. So what I'm trying to say is that if 71% are female, you can imagine that how much, as Arundhati was talking about, that how much contribution the older adults can also make when they are women because of the vast experience they have, because of multitasking by the women, because of taking responsibility when the men were out, but now the women are also out. So it has brought a lot of thinking changes and performance changes by the women. So well-being are important in older age as at any other age of life, because it's not that the little children do not require the mental health. It's not that the adolescents do not require the mental health. It's not young boys and girls do not require the mental health. Every sector of life, there is a need of intensive mental health. But in case of older adults, it is slightly more because they may go into the neurological disorders. They may, not necessarily, go into neurological disorders, as the studies show that 6.6% of the people, older adults, they go into the disability in this age group. That could be the reason. But I am a person and think that this kind of ratio may come down if the care is attended for the older adults. Approximately 15% of the adults of the age of 60 and over suffer from some kind of mental disorder, as it was said. It may not be till date because we need to really now keep on reviewing our research studies, keep on reviewing our parameters now for collecting the data and analyzing the data to see whether really 60 plus people are having a 50% of them demonstrating the mental disorders. So these are some of the studies which were done earlier. Now, older adults for 60 plus of the age, they make a lot of important contribution to the society. Let me tell you, as family members, they volunteer as an active participants in the workforces. They are ready. It is up to the government, it is up to the people to utilize their services. While most have good mental health, many older adults are at risk of developing mental disorders, neurological disorders, or sometimes substance use problems. Now, these substance use problems may be more prominent in male comparing to female, but in a certain region of our country, the female equally get into the older adult, female also get into the substance abuse, depending upon the environment in which they are, depending upon the social circle in which they are. Also, you feel a lot of physical illnesses maybe there like diabetes, osteoarthritis, or sometimes loss or vision, correcting is not done. It is not done. If it is done, there is no vision loss. Now, the most problem are like, for health. One does between good health in health, boredom, because they are not able to see any goal or purpose. If you do not have any goal or a purpose, you think, oh my Lord, how to pass a day? It was good if I was working, but there are ways by which one can overcome the boredom. Lack of motivation, because now what next I can do, what next I can contribute. Also, absence of physical and social support. I think Lata has talked in the beginning, in the inaugural session, that how there is lack of physical and social support because not that the children do not want to do it, but it is the job responsibilities, their own family responsibilities, which takes them away. But they are attached, sitting at a far distance, but they are not physically and put over there to support emotionally to their own family members or their older adults. Also, you find there is a feeling of neglect, a low self-esteem because of isolation, neglect, and there is a retirement, because people are not ready to take the retirement. They think that why am I retired so early, when I'm so active. But then there is an age for everything in the government sector or in the workplace. There's a lot of social isolation, depression, and withdrawal because of losing a spouse or a permanent company. And that's where the person feels that how do I occupy myself? How do I stay? How do I go alone for activities which I was doing together with my company? So these are some of the real major concerns, where one has to understand there is abuse, agree or don't agree, but there is abuse. See, people don't mind the physical abuse, they don't mind the economic security, but the verbal, the psychosocial abuse is the one which troubles, which becomes a big trauma for older adults. And that may lead to depression. Dementia problem, anxiety for little things sometimes becomes very prominent with the vulnerable people who are already prone to anxiety. Now, most of these challenges in older adults occur because, as I said earlier, they were not prepared to accept the coming of this age. It is like a woman is not ready to accept the motherhood, or father is not ready, husband is not ready, or man is not ready to accept the fatherhood or parenthood. So then these kind of problems come more and more. But gradually, people start feeling that I have crossed this age and now I'll be entering into this phase and I should do some kind of preparation for myself. Very good examples are given of preparation after retirement in lots of articles. You can go through that, that how you prepare for your finances, how you prepare for your travel, how you prepare for your home, how you prepare for your children and other kinds of things. So there is a lot of planning which one can do, and people are doing it wonderfully well. I'll tell you that most of the couples who are older adults, 70 plus, they do not want to go and join their children abroad. They say that why do I have to go abroad? Because I have to really support them physically and mentally. Whereas when I am here, I can do my activities, I can do my hobbies, I can do those things which I could not do. I was so very busy in my job responsibility in bringing up the children, in settling them. So people are very, very careful whether they should join their children. Rather, they have started picking up staying in the old age homes by paying money and having good apartments and having good social circle with activities. So look at the mental health planning of the people, who are, and maybe very small set of society, but at least the movements have started. I remember nursing advisor, Miss Cherian, before her retirement from Ministry of Health and Family Welfare, she made, converted her own home in Kerala, a huge house she had, into old age home. That early as 70 early 80s. So she converted that into old age or late 70s. So people started planning about this. She said, I'll go and stay over there. And so many of my friends or people retired can come and stay there so that we can have a similar kind of activities and thinking. But let me tell you, if we are talking about the older adults, there is a concern all over the world amongst the planners. They do require parent support at some times of life because of the change socio-cultural pattern, because of changing of the job responsibilities of children. So there is a need for health services, or there's a demand of health services to these older adults. Now, mental health normally are under-identified amongst the older generation or older adults. People avoid them just because of the old. I just give an example. You go for a hearing test or you go for some problem to a hospital. The person will be taken care very well till the time the age is known to the medical professional. And the moment the age, they say, oh, it's because of the old age. Now, even though it is because of the old age, why the therapeutic intervention should not be done? Why the treatment should be done? Just because I am older adult, I have no right to see that I improve my quality of life. Is it that I need a hearing aid? If I don't need a hearing aid, what do I need? Because I want to have a quality of life. I want to listen to music. I want to listen to all the people very well. Those who are listening, the good things are bad things, and those who are talking loud also. So I don't think, the health professionals have to associate saying that you are old age, that is why you are having a problem. Also, the mental health are not expressed by older adults because they know this stigma attached. And their children, their grandchildren, they will hush it. To whom say everybody will come to know it will impact our children, it will impact us. Instead of saying that let's take you for the treatment or show to the psychiatrist or talk to the mental health psychiatric nurse who can do the intervention, they just try to hush it because of the stigma, even for the older adults. Now, we all know that so many physical illnesses start impacting or causing more of the mental disturbances in people who are older adults because of the insecurity, because of the frailty which they have. They may not be able to go themselves or they may not be able to drive their car. But people are very smart. Also, those who in the urban area, they just hire Uber and go for their checkups. But all may not be falling in that slot. So we have to see that how the mental health care facilities need to be improved in the older adults. So treatment and care strategies to address the mental health emotion is very, very important for the older adult. I just take 5 minutes, so I was supposed to take 30 minutes, but I think you are running short of time. I'll try to wind up in another 5 minutes so that we are able to catch up with the time. So mental health specific promotion for older adults involves creating of living conditions, creating an environment, creating a support well-being, and allowing people to lead a healthy life. Promote mental health depends on the strategies which the country adopts for the older adults, and that's basically by the nursing professional and by the medical professionals, health professionals. The team members have to start thinking about that we cannot afford to neglect this very, very important population in the world or in the country. When we are seeing the population because of the good information, because of maintenance of health, we are able to do. So the strategies are very, very important. Some strategies are there, but unfortunately in our country and the developing countries, very good strategies developed. But when it comes to implementation, you find in some pockets the implementation is there and there is no monitoring and evaluation, and this should be taken as in totality. We need to retrain our health professionals in providing care to the older adults. I shared with you an example that when you go for checkup, oh, this is because of the old age. No, old age, we still need to develop a strategy that intervention needs to be planned care to be given, or committees need to be suggested. Preventing and managing age-associated chronic diseases, including mental, neurological, and substance use disorders. We need to really keep on, telling to the community. We need to really have impact through the TV, through the radio, through WhatsApp. People really look up these things and they get educated. Look at the COVID. How did everybody talk about COVID-19? How did everybody, literate or illiterate, talk about RT-PCR? How did people talk about the bugs? How did people talk about the difficulties the migrators are suffering from? This is because awareness is created through media, through information sharing, through behavioral modification, and that needs to be followed. Also, these sustainable policies for long-term and palliative care. Because there may be some part of population, some percentage of population who would require long-term treatment. And we should be prepared to give that kind of a long-term treatment, whether it is we don't have social security kind of a thing, we are developing the bigger amount, but the social security or their own funds or whatever ways are there, we need to develop those kind of strategies so that older adults do not feel abandoned by family, by the society when they need it. I was reading a very nice story, and in that, how do you earn? No, not a story, it is the truth. I was sharing with my family members where I learned that the people who are older adults, they go and earn the credit hours, they look after the people when they are healthy, but they go and look after the sick people. So those hours which they are looking after the sick people, even though they are older adults, becomes the credit back for them. So when they are not well, the government uses their credit hours and gives them facilities free of cost. Very simple, but very effective. So we need to be very innovative in our thinking. How as government employees, how as planners or Dr. Chanda, who is head of the Department of Psychiatric and the nursing people, can devise these kind of mechanisms and come to the government and help the government to develop strategies. Developing age-friendly services and settings. Again, very significant. I don't think I need to explain. Help older adults to understand aging is very normal and one needs to enjoy the phase of life. Encourage them to talk about their concerns about aging. Encourage them to tell about what difficulties they are going to encounter. Utilizing experience of older adults, which will give them sense and usefulness and dignity. You see, many of us are now superannuating but still active. We are looking for those kind of opportunities. Some of my friends, they want to go to the schools and start with the counseling of the adolescent boys and girls, not in the private sector, but in the government sector, where the children are not getting much of the facilities. So these are some of the which can be utilized rather than sitting in a, that isolated senior citizen welfare board and only grumbling about the food they ate, or we need to really utilize this kind of activities. They have made, the country has made the senior citizen welfare sort of place, and they are registered. But I feel they should also be utilized by the government, whether it is state government, local government, or the central government. Now, taking opportunity to utilizing their knowledge is very important, because this will give them satisfaction, and it will give satisfaction or achieve the goal of the country also. Optimizing, that's what I mean, optimizing physical and mental health. Giving a civilian responsibility, a granny house crèche. The grandfather, grandmother, or all the grannies are there, and then the area can have a crèche. These grannies can look after these people in crèche, but rather than searching for a crèche and also trying to see that, when the parents come back home, they are happy that they must have learned so many stories from the grannies. I do not know. We can have these thoughtful kind of idea, providing security and freedom, like adequate housing required. We have number of old age homes in our country now in state places, and there are a lot of facilities. There are 5-star one, there are 2-star one, they are meant for the people who cannot afford. So you can choose. You can pick and choose by paying and living well, and you can pick and choose when you cannot pay. But these are very less facilities, and people are not aware. This awareness should be created by mental health nurses and these mental health doctors. Also, social support for older people and their caregiver as part of policy of the government, because sometimes this support is not given. Imagine, you are young, you are still smart enough that you can walk. If an older adult wants to go for shopping, he just wants to go for a movie outside, take her or him, and go and take them for a movie or, a garden walk or whatever, or garden meeting out. Also, health and social programs targeted at vulnerable groups such as those who live alone, especially in rural population who suffer from a chronic or relapsing mental and physical illness, and their attention is to be given by community health psychiatric nurse or community health psychiatric nurse consultant. Programs to prevent and deal with alcohol abuse is very, very important. I think there's a lot of action being taken by the code, but this can be prevented. It can be prevented by the thinking. And the need to participate in similar services are not early diagnosis in order to promote and provide optimal health, identifying and treating the complex diseases, managing challenging behaviors, providing information and long-term support to others are some of the things which all of us we can do it. But as mental health nursing professionals and mental health psychiatrists need to really take initiative in saying that such emphasis are placed. With this, I think I need to stop. Let us not forget that the mental health of older adults can be improved through promoting active and healthy aging. Thank you so much. And I know we're running short, and I did try to squeeze 10 minutes for you. So I hope you'll be able to catch up with the other eminent speakers. Thank you once more.
Thank you very much, ma'am, for the wonderful deliberation on mental health promotion of elderly. It is often a neglected area. Thank you for enlightening. No. Sorry for the technical issue. Thank you very much, ma'am, for enlightening us with your deliberation of mental health promotion of elderly. It is often a neglected area, as you all know. So it is right time that you have enlightened us with the right topic at the right time. Thank you very much, ma'am, once again for joining us today. Let us go to the next speaker. I would like to introduce Dr. Renju Susan Baby. She is an associate professor. She's an associate professor in AIIMS Bhubaneswar. One second, let me check. Yeah, let me introduce the next speaker. Our next speaker is Dr. Renju Susan Baby. She's an associate professor in AIIMS Bhubaneswar. She has completed BSc Nursing as well as MSc Psychiatric Nursing from AIIMS New Delhi. She also completed PhD in Nursing from INC Consortium. I'm happy to share that she's my batchmate in PhD Nursing. And her awards and honors includes a rank holder in post-graduation in Nursing, AIIMS New Delhi, doctorate in Psychiatric Nursing, national level trainer for nurses in substance use disorder under Ministry of Health and Family Welfare, Government of India. She is a peer reviewer in Indian Journal of Psychiatric Nursing. She has published 15 articles in national and international journals. She presented 6 papers in international conferences, and her interest includes research area interest includes addiction psychiatry, schizophrenia, mood disorders, and medication safety. May I invite Dr. Renju Susan Baby to start her session.
Thank you, Muthu. May I explain this slide?
Yeah, you can share the screen. Dr.
Yeah, sure. I hope the screen is visible.
Yeah, getting shared. Just go for presentation mode and you can start.
Are you in presentation mode now?
Yeah, right. Go ahead. Thank you.
Yeah. So, warm good morning to all. Happy mental health day wishes from my side and greetings from Names Bhubaneswar. So, I feel it is, I feel a great honor and a proud privilege to share the platform, my own alma mater, and I'm sharing platform with so eminent mental health stalwarts. It is kind of a bit, but thanking my alma mater, my college of nursing AIIMS, New Delhi principal Dr. Lata Venkatesh, and Department of Medical Nursing AIIMS, New Delhi, the head Dr. Naka ma'am, and Dr. Mitu, Ajay Chan Sulbala. Before I talk, I so thank all for giving me this scope. So today, I'll be talking mainly about mental health promotion among patients with chronic medical illness. As nurses, we know every day we are handling patients with chronic medical illness, the medical illness. So when we deliver our nursing care, we frequently focus on physical and very often mental health problems remain unaddressed or unattended. So, like we just always write on the issues that are faced by chronic medical patients, and how we as nurses we can promote the mental health. So we all know chronic disease are chronic conditions which cause disruption in the activities of daily living. And we know that so many medical illness, chronic medical illness have actually cured. So we know we are carrying patients like chronic debilitating disease like multiple sclerosis, rheumatoid arthritis, cancer, stroke patients, or coronary artery disease patients, hypertension, diabetes, HIV, and so on. So we know that most of the treatment disease remain incurable, and they have to live with the disease throughout their life. So many of these disorders often progress to, I know they have chronic disability, increasing disability, and it requires a lifelong stress management. This is about stress of chronic illness. As the illness progresses, when it starts from the when we hear the diagnosis that I am having so and so illness, from that moment of will have the shock. First of all, and as and when they progress with the disease, they experience so many changes in their social relationship, work, and activities of daily living. And we know that this creates disruption in all spheres of their life, no matter in the personal life, the work, financial, social relationships, their life and personal development. For example, a woman with rheumatoid arthritis is in a disabling autoimmune disease. So she has to make so many changes which has to play multiple roles as parents. And this illness includes in all the domains and the psychological well-being related with it. So when we say that about the medical symptom, so the symptom, we are forced, the patient will be forced to make certain undesired life changes. And this undesired or unwanted life changes itself leads to stress. And I could see so many students listening to this talk. I thought I'll discuss the 7 stages of grief of chronic pain because we are used to hear about the Kubler-Ross 5 stages of grief. So let us learn about the 7 stages of grief for chronic pain and chronic illness. So because we may see patients in various stages of grief or for the chronic pain, chronic illness. So we know the first stage is denial. So in the first stage, the individual when it receives the diagnosis and they get terrible shock. They can't deny this is going to happen to them, and they wonder how will it make changes in their life. So this shock helps the person to decide to move to the next stage and work
Sorry to interrupt, Dr. Ranju. There is some echo we are getting and some interruption. May I suggest you to put off your camera, then continue. It may improvise the data transmission. Yeah.
Let me see. Is it better?
better.
Yeah, better now.
Yeah, thank you. So we were discussing about the first thing that is denial. So for those who step in the stage of denial, it will backfire to the individual. So people will say that okay, it is okay, I'll be fine. So that is not going to work well. So next stage is pleading, bargaining, desperation. So here the patient tries so hard to bargain or plead that they want to have this chronic illness. They wish to, the individual also wishes that whether I could go back to the previous life where I was properly, totally healthy. And at times you may feel patients blaming or feel guilty for becoming sick and wondering if it's done something to prevent such illness. And guilt usually comes again as a person blaming themselves for the situation. Next it is anger. You may see the patients without any reason they'll get angry on you. So you have to understand that this is a normal phase in the grief. They are going through the phases of grief. So anger is a crucial phase for the individuals to begin the healing process. There is no specific timeline for a patient to get to the anger stage. So you should understand that displaying anger is quite normal. So what are nurses people do is that we have to remain empathetic as the patient goes through the stage. So sometimes after feeling angry on you, you may feel that the patient started apologizing. So TPA comes later in process when the disease progress and the individual realize that the life will change, and the individual slowly moves towards the next stage of anxiety and depression. So the feeling of depression can be substantial and seems that your patient that if you feel that this is not going to go away, it is going to remain with me forever. And the patients slowly tend to withdraw themselves. And and as nurses, if you feel when you see patients are withdrawn or they look anxious, try to talk to the patient, help the patient to get out the feeling. So let us understand their feeling. So, sometimes I teach them how to handle their anxiety, teach them specific techniques, so that will help them to move ahead and ensure that they go ahead from the stage of anxiety and depression to the next stage. So we have to push the patient to the next stage of grief, that is the loss of self and confusion. So this is very much real for the individual with chronic illness, especially when the illness is disabling in nature. In this case, the life has changed so much for the individual and they do not recognize themselves. They're totally, their life is became different. So for example, patients with arthritis, they feel that they can't do the things which they used to do earlier. They used to, it might have, they have to redefine themselves. And sometimes it gets much with the stage of depression and anxiety. And once the patient has some confusion about pushing themselves, and once they develop that concept of self-esteem, regaining the self-esteem, they start moving to the next stage that is realization of life goals and goals. So patient will be thinking, how do I proceed further? How do I adjust it to the new life? And they started proceeding to move their roles back as a wife or mother, husband, being friend, and so on. Then they proceed to the last stage, that is acceptance. When the patient accepts this is her new reality and he considers that this is my so-called new normal. This is how my life is going to be. So I have to accept and I have to go forward. So clients usually feel not usually okay and sometimes feeling happy and they should feel that it's okay, this is how my new normal is and I should focus on my one, I should proceed further. So each process you have to understand to provide proper care to the patient. So let us see what are task a patient with chronic medical illness need to take up. Few chronic illness related adaptive tasks that they have to keep the symptoms under control by taking proper pharmacological or other related treatment, and they have to have a good rapport to help with professionals. And the general relative tasks like maintaining emotional balance, developing the positive self-image, relationship with loved ones, preparing for an uncertain future. And second, cognitive that's also individual need to make. So first is making a meaning of their illness. Next is revealing mastery and restoring self-esteem. So making a meaning of their illness. That means they should understand that why it. So they may be having a question why it happened to me. But slowly we have to get a we have to derive a meaning of why. Why this illness are happening to me. If it is because of management with the stresses, so I have to handle my stress. So successful meaning making had a positive impact on management of the stress life and including living without caring for chronic illness. Next is mastery. So individual mastery means individual perception of control over life events and capacity to achieve desired outcome. So mastery protects individuals against depressive symptoms. So once they started understanding their disease process per se, and they started taking measures to handle the disease symptoms, how to get the disease symptom under control, and slowly the individuals will learn to achieve mastery over their illness by adapting active coping mechanisms, and slowly they restore self-esteem. So how they can restore self-esteem? Taylor has described a beautiful concept known as people can cope with the threatened events by comparing themselves with less fortunate others to maintain a positive outlook. That is very much it makes a big sense. When you see a patient who is very upset of having a lumpectomy or having a breast lump, you can just throw a light. See, your life is much better. You just see the patients who had undergone mastectomy, so his life is much better. So patients who had mastectomy, they can compare with patients who had cancer, which is metastasis has already occurred, already spread to the vital organs. So they can find, okay, my God, I don't have that severity, or my cancer is looking something, my cancer, it has not been metastasized. So that helps a person to achieve control of the better situations. So that increases self-esteem. So if I don't speak about the this child, we have to have an understanding about the adaptive and maladaptive coping styles. Because when we talk to the patient, we have to see what are the coping methods that are adopting. We have to see that whether they are adopting adaptive coping, that is problem focused strategy, or whether they are adopting emotion focused strategies, whether they are adopting maladaptive strategies like avoidance coping. So problem focused coping means they will plan their daily life. They seek support whenever they need, when they need pain, or when they feel that they're going to have a next player. Seek support, seek treatment at the earliest. So that problem is coping, which we consider adaptive coping. This is mostly focused coping. So they tend to use this coping to manage their own emotional distress caused by illness. So especially if feel uncontrollable, sometimes they express notes on others, or sometimes they choose self-fulfilling activities like going for a party or going for a shopping, or venting out emotions by seeking emotional support. And sometimes those who use maladaptive coping, they tend to escape from the situation by denial, or they tend to end up using drugs or alcohol. So when we go mental health and physical health is like inseparable, one complements the other. So mental health is a state of well-being in which individual realizes his or her own ability and cope with the normal stress of life. So that they can productively and fruitful and is able to make a contribution to his or her community. So many times over a period of time, if it is very with chronic mental illness, they have so many other mental health morbidities. So many times it is very much difficult to differentiate between the two, which started first or which global, what has happened with the patient. So the comorbid health risk factors for so many chronic physical conditions, stress causes so many psychological disorders, and patients patients or people with serious mental conditions are at higher risk of experiencing chronic physical conditions. And people with chronic physical conditions are vulnerable for developing various mental health disorders. So let us have a quick glance of various mental issues the patients with chronic illness may suffer with. You know that the prevalence or the risk of having depression, but the depression among a diabetic patient is 2 times greater than non-diabetic. Or the diabetic patients with diabetes vulnerable to develop panic anxiety, general anxiety and PTSD. Otherwise, they're more vulnerable to develop mood disorder in their life, mood disorder and anxiety disorder. Patients with heart disease, they are vulnerable for developing anxiety and depression. And we know that they are much vulnerable for developing eating distress and depression. Patients with gastrointestinal disorders. So depression and anxiety are more common among patients with chronic medical illness. So, for example, when I take the psychosocial perspective of cardiovascular disease, comorbid depression and anxiety is prevalent in 20% of the patients with cardiovascular disease. So, which can be either transient depressive episodes or a chronic depression. So, distress with this depression, it often makes them more vulnerable to non-compliance with the medication, which serves as a barrier to behavioral change. So, when we see, in all the medical disorders, when we assess the depression, so we can see that after 20 to 30 years, we can see up to 45% the person who smokes, they have that depression. Among obesity, there is 34%, and the person varies from population to population. So when we consider spiral, you can see that when the individual is in a stressful situation or even they tend to physical symptoms like tiredness, fatigue, they tend to be less active. Their appetite changes, some few increases their appetite, few reduces their appetite, and they predominantly the mood becomes sad, and they have multiple things, and they have deficit actions, they feel helplessness, hopelessness, worthlessness, they have trouble in concentration. Ultimately, it lasts for more than 2 weeks, it ends up in depression. So diabetes and depression. So it mostly like diabetes, they have abnormal level of norepinephrine, serotonin, high levels of cortisol, loss of energy, anxiety, suicidal thoughts, changes in appetite. That leads to depression. So that leads to stress in the daily diabetes management also. Sometimes there is a connection between doctor and patient. It leads to fatigue, exhaustion. It often makes them difficult in making dietary changes. When we see the model, which clearly explain with direct and indirect effects between physical and mental health. So when in a patient with diabetes, the efficacy of physical factors like increased heart rate, headaches, hunger, sleepiness, and this mood, the bile mood or mood changes or the resulting concentration, that may have it that will impact on physical health, that is, the diabetes will be uncontrolled or it may result in depression. And there are certain mediator variables which understand that is social factors, like social isolation. If they are need to rely sources, they tend to remain physically inactive, they have decreased engagement, they don't focus much on diet, and they don't handle stress, and if they have financial problems or affordability of food, it makes for the comprehensive scenario. So, help the patient with chronic medical illness to move towards the positive mental health. So, when I talk about positive mental health, what are the factors of positive mental health? Positive mental health is the factors of positive mental health. There are 6 factors which are described by Lunt's model of multifactorial model of positive mental health. That is pro-social attitude, self-control, autonomy, personal satisfaction, purpose-holding, and self-actualization, and a personal state. So we have to develop, no matter if I have medical illness, that should not hinder my ability to help others. I should remain altruistic, and I should be able to accept myself, and I should be able to accept others also. I should have control of my ability to cope with stress. I should be having emotional balance, and I should have tolerance to frustration, anxiety, and stress. And I should have autonomy. I should have my own standards. I should be independent as much as possible. With whatever disability I have, I should remain as independent as possible. I should be able to regulate myself, my behavior, and I should have my confidence or ability. I should be happy with things, I should be happy with whatever I am, whatever situation I am. Let me feel that happiness, let me feel the blessing. Because if I am disabled, if I am sick, but I have my family, I have my children, I have all of my all other organs are functioning apart other than my joints. I have problem only in my joints, or I have all other systems working properly. So that feeling of gratitude and personal satisfied with their own self. And we should also have the ability to reflect the problem. They should be having an ability to make proper life choices. And they should have its flexibility in adapting to the change and welcoming the new normal life. And for everything, we should have a good idea. You should be able to support each other, even if you maintain a good idea with others and empathy to understand others. So, in the journey towards positive mental health, a patient with chronic medical illness, they should be able to make therapeutic lifestyle changes because most of the illness, they didn't feel better, they should make lifestyle changes. So, controlling their alcohol or smoking habits or making modifications their diet, increase the physical activity, exercise, managing their obesity and handling their stress. So when we patient who is abusing or who is using smoking, who smokes or who uses alcohol, but please educate them at home and what are the benefits. So the substances you can motivate them to stop or quit, and you can even refer for proper active psychiatric services and exercise. We know that walking for 20 to 30 minutes, or doing exercise that lift your mood, and it helps to manage your stress and anxiety also. And making some, so as well as we have to assess the dietary habits and encourage the patient to have a healthy diet, which is dominating plant food based diet, which includes high fiber, whole grain, legumes, vegetables, fresh fruits, and minimizing the amount of recycled diet, animal protein, sugar, and salt. Then other thing is that how to handle, we should teach them how to handle stress and handling obesity, proper extreme modification based to allow to keep the weight under control and teaching them cognitive behavioral stress management techniques, especially teaching them mindfulness exercises, mindfulness meditation, mindfulness exercise, and breathing and relaxation techniques. And also cognitive strategies like finding irrational thought pattern and engage little more rational thoughts. So this behavioral stress management has found to be improve their reduce the stress and improve the functioning, especially in issues chronic illness. When I talk about mindfulness, mindfulness means mindfulness meditation, yoga, and mindfulness exercise. Learn to live in present and be aware about their own body changes, and it helps them to have a control over themselves. I say psychotherapy. So as mental health nurses, we should learn the impact of positive psychotherapy in providing positive mental health. Positive psychotherapy means focus on improving the attitude towards their life, and it also helps to enhance resilience. So here the patient and the therapist assess the parameters of functioning, like discussing what are the goals and values, what are the standards of living, and what are the attitudes towards life, what are the relationship, friendship, how is the relationship with children, how is the relationship of the patient with the family, neighborhood, and community. That initial, after performing initial assessment, the therapist is to learn to provide a gratitude visit. So there is a right and delivery letter of death within this chronic illness. And for so many things in my life that God has gifted me. And they'll make them write the good things that is happening in their life. That's right of their chronic illness. And they will help to develop a concept that what is, what were you when you are at your best. So right, I think the individual were at their best, and that will help to reflect on the strength. identify the strengths and use them in a new way. I posted interventions which has reported self-increased efficiency. And also that teaches to letting go of obligations that doesn't really need to do. Say no to things which you can't do it and accept what you can do it. And also the therapist teach the individual to fucking time themselves. That is very much important. No matter you have to find a time for yourself. Do things that you like, do things that these factors that is very much important for developing mental health. And to build the resilient hands to intervention like ready program. So they focus on the five resilience factors of positive emotions, cognitive flexibility, social support, deriving life meaning and active coping. So this gives individual interventions. The family and community interventions are also important to developing positive mental health. So, encourage them to join self-help groups if they have arthritis self-help group or diabetes self-help group or cancer self-help group. Encourage them to join because that participate self-help group makes me really realize that I'm not alone in this. I'm not only I'm suffering. There are so many people are suffering and they're doing so many good things. So I also can do well and I can regain my new self. So complete interventions also are important, including educational and enhancing social capitals. So what as nurses concluding because we are running short of time, as nurses because we meet our patients various case of illness. Mostly in the acute phase or during the flare or during the up of the illness, they see they are hospitalized. So as nurses, please find some time to assess their mental health so not only the patient's family also talk to the patient and family, assess their mental health status. So that should be made mandatory as part of a nursing assessment. And identifying the issues faced by patients and identifying which stages these actually they are in, whether they are stuck in some stages or if they are experiencing neurological maladaptive grief or it help them to handle this stage of grief. And so you should be able to go and grief one. Grief is nothing but allowing them to vent out feelings, listen to them, so that you will be able to, once they then vent out feelings, they will be able to move on stage to another. Because the deviation during the assessment, you feel that this patient is having this many mental health problems since more than a month or more than 2 weeks. So if you feel that if really it is having having a clinical depression, if you feel that is having anxiety disorders and depression, please do refer to the psychiatrist. And so that identifying the deviation in the mental health and deliver appropriate psychosocial intervention. And handling individual crisis. The individual obviously and individual along with the individual the family moves they develop a discrete crisis then the beloved one was diagnosed with an incurable medical illness. So I think next talk is about handling crisis, so I will not be discussing much. And this is the deviation of the health I will do appropriate perspective. That is also our responsibility. And nurses should strive to promote positive mental health. Nurses should take to adaptive coping strategies, correct if they're using maladaptive coping strategies. If they're if there is reaching alcohol or tobacco as a coping, teach them that is maladaptive and help them to adopt adaptive coping like problem-based coping strategies. So to conclude, we won't that's no health without mental health. Without if you mentally are not healthy means whatever physical health you will not be able to feel the health also. So mental health is closely related to physical health. So as nurses, we can do so many interventions to promote mental health of person with chronic mental illness like stress management technique, positive psychotherapeutic and helping them to use therapeutic life stages that will help in improving physical health of patients with chronic illness. So that is help from teachers that to adjust with the new normal life, and remain, let them remain anchored to what they have and live in present. Because COVID has taught us so many things. So COVID taught us that see, life is so inconsistent. We have to live today. Don't worry too much about what will happen to me after so many years. Let us not waste time and thinking too much about future. Let us live in present. I have only today. Let me live the today to the best. Let me be happy and enjoy my time with my family. And this illness is okay. It is a part and parcel of my life. And I should go ahead with this illness. So keep that instill that optimism in them, instill that positivity in them. That is what as nurses we can do to promote health. So as nurses we play a pivotal role in promoting the health of patients with medical illness. So with this, I conclude my talk, and I sincerely thank the director and New Delhi Principal College of Nursing, all the organizers and participants who listened to me patiently, and I thank my affirmator and my teachers who taught me psychiatry, my beloved Sunday ma'am. So with thanking everybody, I conclude my session. Thank you so much.
Thank you, Dr. Enchu, for your wonderful deliberation on mental health promotion of patients with chronic illness. Often, patients with chronic illness are neglected about their mental health. I think you have highlighted the importance of taking care of both of it together. And thank you very much once again on behalf of College of Nursing AIIMS, Dr. Enchu. And I have the privilege to invite the next expert speaker. Let me share the screen. Here we have Dr. Catherine Purnaselvan. She is PhD, MPhil Nursing, MA Psychology, MSc Psychiatric Nursing, and she is currently a lead mental health instructor, Middlesex College, Edison, New Jersey, USA. She is also visiting professor in Global Health, Chamberlain University. She is also a student nurse advisor, ACEM Committee Chair, Standard 3, New Generation NCLEX Preparation Instructor. Some of her awards and achievements include Best Outgoing Student and Gold Medalist in 1995, Sri Ramachandra Institute of Medical Science, I hope, SRIPMS. Best Outgoing Student, a topper, 1999 in CMCH Velu. Best Researcher Award in Manipal Academy of Higher Education. Then Best Classroom Instructor Award and Most Inspiring Faculty Award from Lincoln School of Nursing in addition. So these are some of her achievements, and I take this opportunity to invite Dr. Catherine Purnaselvan to present her topic. Ma'am, are you there?
Yes, I'm there. Thank you so much. Can you hear me?
Yeah, one second.
Yes, thank you so much for your introduction and for those nice words. I'm truly honored, and thank you, Dr. Lata, for giving me this opportunity. My relationship with Dr. Lata goes back to 1991 when I was a nursing student at Sri Ramakrishna College of Nursing, Coimbatore. She's a knowledgeable instructor and an influential nurse leader. I'm so happy and proud. And at the same time, as a principal, to have her as a principal. At this time, I also would like to share my happiness as I met Dr. Bimla Kapoor. She was one of the most inspired persons I always loved. because in fact I loved her in so many ways. The concept of IGNO, which was very new to India, even now when I think, it just brings me goosebumps. And I have to give special recognition and acknowledgement to the organizing committee for putting in so much of efforts to organize this webinar, to all the speakers who did a fantastic job of delivering the conference, and again the student body and the audience who are patiently listening. So are we all awake today? I know from morning 9:30, everyone is glued to the chair. So can you just take a minute to stretch yourself? I think that's a very long time. I'm not sure how your attention span is. Okay, so I'm going to share my screen. Can you see?
Yeah, it's getting shared. Go for yeah, it's shared.
Okay. Okay, so most of you are familiar with the topics of EC, airway breathing circulation, and cardiopulmonary resuscitation. Are you okay, or are you familiar with this term CPR during a mental health crisis? How many of you are very familiar? Can you just put answers in the chat box? I don't be very not talking to hear your responses. How many of you are very familiar with the mental health crisis to use it? Okay, so we can check your answers. So as I told you, mainly know what the CPR is and to initiate the CPR when a person complains of chest pain and experiences heart attack. But when someone says, I want to kill myself, are you confident to handle someone going through a mental health crisis? There is the first aid for mental health, and timely use of this mnemonic energy can keep someone safe. So these are my objectives. Understand the prevalence of mental health issues, including PTSD, a growing concern among nurses in inpatient settings. So this article got published in nurses.com in 2021. So this is again becoming very, very prevalent, and I could see so many of the nurses' critical jobs ever since COVID came in. This is a best practice that require the use of mental health first aid, create an awareness of mental health first aid, develop an action plan, and encourage the technology to identify and assist both in crisis and find treatment. So these are the objectives. So as you all know, these are the numbers. So according to Joshua, he's the director of National Institute of Mental Health. There is power in numbers. Mental illnesses affect tens of millions of people in the United States and across the globe. So it is not surprising that COVID-19 pandemic increased incidence of mental illness, resulting in higher suicidal rate. Hence, it is vital to raise awareness, to understand and respond to the crisis. So most concern right now is increase in suicidal rate. So I have a couple of graphs. The first graph is mostly like a trend graph. So it was so stable. The suicidal rates were stable between 1999 and 2017, and then there's a slight increase at the end of the period. So again, if you see this, according to NAMI, National Association of Mental Illness 2021 data, suicide is the second leading cause of death among the people aged 10 to 34. So this breaks my heart. Whenever I see young teens, young adolescents committing suicide, it really breaks my heart. Because you can see that mental illness and suicide are increasing problems. It's not only a problem for the adults, but also for the children and teens as well. So as you know that, right now, one example I quote, the NEET examination in India, which is causing so much pressure, is you have to mute. The rest of the people have to mute. So it is causing so much of of the children. And one story I heard is the girl got very disappointed once she got to sports. The father was there in the morning, knowing disappointment and a sad face, took her out, was there with her throughout the evening. After evening, he came home. He left her for 45 minutes to bring the mom back from work. When they came back, the girl committed suicide. So it is such a saddening situation how the NEET exam is putting so much pressure on the Indian population, and this is an evidence. So again, this graph is taken from the CDC site, Center for Disease Control. Again, this is the latest one, 2021. If you see this, symptoms of anxiety disorder, depressive disorder, it is also increasing in men. So when you say anxiety and depression are increasing, this in turn can lead to a state mental health crisis. So one more shocking news with India is India ranks, especially within according to the World Health Organization, the age standardized suicide rate in India is 16.4 per 100,000 per women, which is sixth highest in the world, and for men it is 22nd. So this again was the shocking statistic that India stands sixth in the world for suicidal rate in women. So some more facts from the global perspective, especially some of us who have experienced some in the problems of we can see all this data like throughout the world. So from a global perspective and from the World Health Organization, there needs to be more availability of mental health services, including those throughout the globe. So there is shortage of services. So that's what we're talking from the morning. And you can see that there is a need for access to global health, mental health services. So the goal of World Health Organization by 2020, universal coverage, which ensure access to quality and affordable health care for mental health conditions in 12 priority conditions, 12 priority countries to 100 million people or more people. So this is the task of the, or this is the task, or this is the goal of the World Health Organization by 2023. So if you remember the definition of health, health is a state of complete physical, mental, and social well-being, not merely the absence of any disease or infirmity. So mental health is part of physical health. So how is everyone doing so far? Are we all okay? Can I get an A or no response? I want you to talk. Is everyone doing okay so far?
Yes, ma'am, we are doing okay.
Thank you. Okay, so defining crisis, most of you know this definition because some of you would have taken psychiatric classes. Crisis is not pathological, but represents struggle for equilibrium and adaptation. It is personal in nature, meaning it is purely subjective. What is considered as a crisis for one person is not a crisis for another person. So there are different types of crisis. I have quoted three. First one is situational crisis, otherwise known as external crisis. So the definition states, unanticipated change or loss experienced in everyday, often unanticipated life events. For example, death of a loved one. Now, with COVID, so many people are dying, or loss of a job. Next-generational or internal crisis. So achieving new developmental stages which requires additional coping mechanisms. Examples can be becoming pregnant, promotion, attaining menarche or menopause. Advantageous crisis, the occurrence of natural disasters like tsunami, crimes of natural disasters. You can remember the Taj shooting in India. People in communities with large scale psychological trauma caused by natural disasters. So here are some examples. I want you to identify these examples which you answer in the chat box. So the first picture is a picture of tsunami. What kind of crisis is this? Can you put your answers in the chat box? So this is a picture of divorce. Again, someone getting married. And then this is again COVID. So COVID falls under which type of crisis? I may have to forgive from New Jersey. Can I have the answer from someone? I will make sure it reaches you. COVID falls under which kind of crisis? Louder, there's no wrong or right answers. COVID falls under which kind of crisis? Natural crisis. Adventitious, right? Because it is the kind of natural calamity, natural disaster which no one anticipated. It is not situational. So when you say situational, it's more like what's happening in a day-to-day life. Okay, but thank you for trying. Okay, let me go to my next slide. So these are some of the common crisis characteristics. Experience a sudden event with little or no time to prepare, because it's some like a flood. Perception of events as overwhelming or threatening. Loss or decrease in communication with significant others. Sense of displacement from familiar and actual or perceived loss. So as you all know that when crisis happens to you, most of us or some of us have experienced the crisis in our lifetime, right? So anxiety escalates. We try to use all the defense mechanisms, and you notice we go through a trial and error method of coping. We become disorganized. There is failure of the defense mechanism, which leads to overwhelming anxiety, panic attacks resulting in flight or withdrawal. Again, the person in a state of anguish, apprehension, feelings of powerlessness, dissociative findings like demotivation and derealization from reality, again leading to depression, confusion. Finally, the end result is the person can become harmful to self or others. So what you have to look for is, you want to look for the cues and be aware of the one time. So by the way, in the US, we are getting rid of the nursing process and we are replacing the new model, what is called the judgment model. So those are something like very similar to the nursing process, but we are looking for cues and analyzing the cues, like a part of it. So what you want to look for is, you want to look for cues. You want to look for an emotional stress. You want to look for an emotional situation. For the high-risk patients, there is a patient under influence, alcohol, or any other drugs, any history of violence, homicide or suicide, any psychiatric history, and high-risk situations. As I told you, there's growing concern that nurses might get PTSD from working in inpatient units. And one more thought came to my mind is, so many of the people have lost their loved ones, a mother, child, or someone who's very, very close to their heart, have died because of COVID, and they were not able to perform their last rites or rituals. So these people can go through a kind of disenfranchised grief. So is there anything like a follow-up study, or have people support to these people? So what kind of illnesses these people are in? So these are thoughts. So I want to know your experience. Think of a situation you experienced or witnessed. What were the cues in the patient? How was it handled? Write down some key points from the experience. So as an individual, have you come across any situations of a crisis? Have you handled it? And what are you looking for? So this is for you to do like an activity. Since we do not have time, I'm skipping this and I'm going to the next slide. So coming to today's topic, history algae. So what's fascinating about this algae is it was started by a nurse. That's why it caught my attention. So the name of the person is Rakesh Chanda. She was a nurse from Australia, and the mental health literacy professor Anthony John. Together they started this mental health first aid in Australia in the year 2001. And then they came up with this mnemonic called as AIIMS. So AIIMS is an assessment tool to identify and assist those who are going through a mental crisis. As the National Council for Community Behavioral Health (SCA), AIIMS is a mnemonic instrument used for mental health first aid 5-step action plan. So this is AIIMS. This is an Australian collaborative. The mental health first aid mascot named for the acronym. So you have the US one and the Australian one. The mnemonic goes like this. So this is the meaning behind the AIIMS. A stands for the first step in the intervention is to assess for suicide or harm. L stands for to listen non-judgmentally. G stands for to give reassurance. E stands for to encourage appropriate professional help. And final E, the final step is to encourage self-help and other support strategies. So this is what you have to memorize in AIIMS. So the first step, what will you assess? So one of the important things is as psychiatric nurses, we often would be very comfortable to ask the patient whether he is suicidal or not, whether he has an intent to kill himself or kill others. So you want to look for overt and covert comments. When I say overt comments, the patient orally says, I want to kill myself. When he or she says, life is not so worthy, life is gloomy, then you look for overt comments. If the patient has any plans, vitality, any access, and any recent history of mood changes, especially if they are on antidepressants. The next step is to listen. When it comes to listening, from all of you were listening, but how many of you were taking? Right? Always I tell my students, if you are a psychiatric nurse, normally you should have 2 years, but when you become a psychiatric nurse, you should have a 3rd year to listen. So under listening, there are 4 levels of listening. The first step of listening is being an attentive presence. So you have to make the patient feel that you are physically present with the patient. So you want to use the solo technique. So if you are very familiar with what is solo and for, sitting squarely, open posture, leaning forward, eye contact, and then relaxing. So most often you make the patient feel that you're open and you are attentive. The second step is clarifying and interpreting feeling. So here, in this step, you want to use all the techniques of therapeutic communication, like restating, phrasing, reflection. The third step is to provide empathy, not sympathy. Most often, it takes to become advisors for the patient. Here, we want to put us in the patient's shoes and feel the patient is going through, what he or she is going through. And the last step is to actually generate, meaning that you fully enter into their patient's world. So at this stage, you reassure the patient that help is available so that you can instill hope. Next, D stands for giving reassurance. As we told earlier, we should not give any kind of false reassurance to the patient. We should not advise the patient. E stands for encourage professional help. So that's one of the sentences Lata said this morning is he's not able to take care. There is a different patterns in the past that makes an effective. I would say it's dash for mental health and mental illness. Most of them are very okay to go to a plastic surgeon, fix our nose or ears or eyes. It's okay to go to the beauty parlor, and we are okay to go to the cardiologist. But how comfortable are people to go and get help from the therapist? So here we need to try to eliminate the stigma and let them know that they are not alone. Come out of the stigma and seek professional help. So we want to offer the resources available, like the hotline services, local mental health support number. So if you are in the Delhi area, you know the hotline services to offer one. The next is encourage and help. You know the best programs in your locality, and you direct them to the support groups. So encourage them to get help. Ask them questions to know, do they have enough information? So tell them, like, is there a psychiatric case near? If you are going through domestic abuse or any kind of violence, do you know where to get help? Once they get more support, they will be able to learn better how to cope, especially their problems and manage their problems. So here's one more question. Again, I can send a prize to Dr. Lata Rakesh. I want you to answer this question and put your answers in the chat box. Okay, just answer me. A nurse was able to say, I scored low in my NEET exam and I'm such a failure and plan to commit suicide. Which of the following assessments should the nurse identify as the priority? All the options are right, but you want to know what the priority are. Science, educational background, lethality of methods and availability of tools, quality of client's social support, client's insight into the reasons for the decision. We put the answers in the chat box.
Of B.
Okay, B's. Okay, so how many B's are there?
Now, couple of B, I think now more B's and one couple of B.
Okay, I think that's a good answer.
I think more of B and D.
Okay, so if you have chosen B, that is the right answer, right? You really want to know the lethality. Suppose if the person has access to guns or she has access to some kind of medication, or if she has access to jumping in the well, do it in very, I mean, most often they do it in India, into the well or they drink some kind of poisonous. These people need more care than other things. So I will try my best to send back to talk. So we have a couple of people who have answered the question. So thank you so much for this, answering this. Okay, so what is the outcome and evidence of this algae? So it is a peer reviewed, most studies are peer reviewed. That means you know that it is evidence based. It tells that the intervention of this algae is effective. It is easy to learn, easy to use by anyone and in any setting. You don't have to be qualified to remember this algae, right? Anyone can use it. Still, it is new to the public or it is not known at all. Most even in the US, they say there is no people not know about this. And training is available for mental health first aid, which started in Australia, new to US, and we do also have it in India. Anyone is aware of the Indian place? Have you heard of this topic? Anyone is aware of the Indian place? Okay, so it is there in Chennai. You can always look up for the, if you are interested, I will give you a phone number after this. It is an 8-hour training. You can get certified and it is valid for 2 years. You know, most often in the US, we all get certified for CPR and our certification is valid for 2 years. Every 2 years, we have to renew our certificate. So same way for mental health crisis also, we go through this training. It is 8 hours and then the certification is valid for 2 years. If you're teaching, you can also become the trainer for the mental health. So some of the important facts. Algae can identify someone with mental health crisis, but it cannot give a diagnosis. So you cannot label someone depression or can identify them as going through a kind of mental health crisis. So this is one of the limitations. So let's get personal. Using the mnemonic algae, how would you handle the situation? I want you to watch this YouTube video for a minute and think in your mind, what are the steps of algae? How am I going to handle the situation? Okay, Okay, so if you are in that situation, using the knowledge algae, how would you handle a situation like this? I mean, you don't have to think big. Maybe a student failed an examination. She's not able to graduate. She fails the last semester with 1 How would you handle the situation? So some of the key takeaways of this presentation is you can always catch it early. Prevention is always better than cure. Look for the warning signs. Education. So you have to teach the public, create an awareness, and the goal in scientific nursing is you want to keep the patient safe and others safe in the environment. So some of the concluding thoughts, as I told you, allergy can identify a mental health crisis, but it cannot give a diagnosis. It is easy to use, and nurses can understand the mnemonic like IPA or ABC. Mental health will continue to be a global issue. We have to remember COVID is still existing, right? We don't have to pretend it is going to end. The prevalence of mental illness is increasing day by day in India, and the statistics reported by the World Health Organization are alarming. It is so scary to see the numbers on rise. Mental health first aid can reduce the impact of mental issues and illness. AIIMS is a public education program that can help individuals across the community understand mental illness, support timely interventions, and save lives. So courses on mental health first aid are offered in many countries. You want to check the availability in your location. So these are my preferences. So as I told you, Erinda Shah is the foundation member, is the founder and MD for the mental health first aid in India. And I do have a phone number for this. It is 7397383004. So if anyone is interested to get trained, you can contact this number and then you can become a trainer, or you can also be certified in the mental health crisis. Do you have any questions for me?
If any questions, you can type it in the comment box.
We talk so much, and every year we want to celebrate mental health, but mental health is one of the neglected areas in so many aspects, right? Because of the stigma attached. At least in the US, people they talk up openly about mental health issues and crisis, but still we are lagging behind in talking about mental health issues. So we have to come out of the barrier, and somehow we have to help people because the need is more right now.
Thank you very much, Dr. Catherine Forna for your wonderful session on this new topic. Wonderful session on this new topic, that is CPR CPR in mental health. I think it's a new concept, and it was an interesting session. And I once again extend my thanks to you for accepting this invitation at the with very short notice, and connected with us today all the way from USA, despite your busy schedule. Thank you very much.
I want to thank the organizers once again, and I think you all deserve a big round of applause for doing such a good job. Thank you again. Thank you. Nice meeting you in this platform.
Thank you, Kat, for this one session. When I met you first time, when you were interested to be unique, think out of the box, and always learn something from you that way whenever we speak to you. And thanks for enlightening the audience, and we will continue to associate with you in future, and probably we must look for some joint activities. As Muthu said, it was, I think, less than 24 hours when we invited you to address it. Thank you for accepting. And yeah, and I must thank the organizers for taking efforts to
host the events of World Mental Health Day. Thank you.
Thank you, Dr. Lata. And I owe a bag of chocolates to all the people who answered my questions. Probably I have to send it to you. Maybe I have to talk in person to you about this.
Yes. Thank you. That's really very kind of you and very encouraging.
Once again, I take this opportunity to thank all the speakers, Dr. Catherine, Dr. Bimla Kapoor, Dr. Renju, and Dr. Aranjodi Barwa for enlightening us today, and Dr. Lata Venkatesan for supporting us to organize this program, Dr. Deepika Kaka, and my fellow faculties, Dr. Mr. Ajesh and Ms. Surbala, and all the students, participants, and all the delegates who joined from all across the country, and also actually there are delegates joined.
Thank you very
from
much.
Outside the country. Thank you very much.
We are expecting your participation in future also. I have shared the feedback link in the comment box. So now it's open for your feedback. Once you complete your feedback and you will receive the e-certificate, make sure you spell your name correctly in the name column of the feedback.
Thank you. Column of the feedback form. Thank you.
Thank you.
Yeah.
Stop karo.
Yeah, just sharing the feedback link, otherwise it's over. Lost my network connection.
It's there in the chat box. Can I copy it and paste it again?
Yeah, no, I pasted.
Hello, congratulations.
Thank you so much, Surbala, for joining. Thank you.
Yeah, thank you.
Hope you're having a good time there.
Network connection is poor. Huh? I think today some problem due to network also today. It's not just from their end.
We can just leave.
Yeah. You can close.
Closing.
Thank you, Muthu.
Thank you.
Thank you, Rakesh.
Thank you, Renju.
Thank you, ma'am. Thank you so much.
Thank you, Dr. Renju, for joining us today.
Thank you, Lata. Thanks so much, everybody.
Yeah, with your mask we cannot hear. It will get
We can
echo.
leave, no?
Yeah, please. Thank you.